Guys, welcome to my channel. My name is Liz and today is the second part of the birth control horror story. Now the first part was about all the different birth control methods, contraceptives, what have you, and my Nexaplanin horror story. And this video is going to be all about my IUD horror story. Now before I do get into this, a couple disclaimers. I did forget, I think, 3 or so of the different birth control methods, which was the withdrawal method, which is formerly known as the pull-out method, which doesn't really work, and the obviously with staining from sex, being abstinent, and the timing your menstruation so you know when you're ovulating and stuff like that, so you avoid having intercourse during those days. But anyways, let's just get into my IUD horror story. So my IUD inserted in August of 2020, and then I got my Nexaplanin removed of January 2021. Now, the spotting that I experienced for 3 years stopped a week after I got my Nexaplanin taken out, and I started menstruating regularly in about the beginning of March. Now, the first menstruation that I experienced after getting the IUD inserted and the Nexaplanin removed was extremely heavy, like heavier than I ever experienced, and I've been menstruating since I was 12 years old, and the first 4 days were just awful. It was just pretty heavy. I believe it was like an ultra tampon every maybe 3 or 4 hours. So that concerned me, but it stopped after 4 days out of the 8 days I normally experience menstruation. So I was like, okay, whatever, you know. Now this started up again, right, in the middle of April, and it did not stop, and it actually got worse. I was menstruating and going through an ultra tampon, which is the biggest tampon you could buy, and it holds about 15 to 18 grams of menstruation or menstrual blood every 2 hours. And I'm not exaggerating, I'm not kidding, literally an ultra tampon every 2 hours, and I would even bleed through that, and like a full pad, and through my pants on several occasions. Just a nightmare. And it was going on for about 4 weeks. Now, I didn't even notice that length of time. It was actually my boyfriend who like noticed it, and I was like, he's like, you've been bleeding for like a while, and I'm like, you know what, I actually have, but it's just, I have a busy schedule, okay, like I work 6 days a week. Time is relative to me. It doesn't matter. So I was like, yeah, you know what, you're right, I've been feeling real tired, more tired than normal, and it's just like, I got a few leg cramps just like normally when I was trying to stand up, and it's just like, and then I was starting to get dizzy spells, and it's just like, you know what, I made an appointment with my OBGYN, and I scheduled to get the IUD taken out, because it was just like, you know what, I just don't want to do this anymore. This is just ridiculous. So I go into my consultation, and I was late, because of freaking traffic. I'm always late, but like traffic made it worse, and I was just thankful that they saw me, and I was just like I even told the receptionist, I was like, can you emphasize like her seeing me, because like, and mind you, I hate being in like a medical office or like the hospital, because it's just like, there's no privacy, initial privacy. They're like, what are you in for? Basically, like, why are you here? And like, sometimes there's a room full of people, and you have to like tell why you're here, and it's just like, I wish there was some kind of like room. Obviously, like, you get situated in another room, but I wish like it wasn't just like such a public area where you have to like describe like why you're here, why you're, you know. But that's just another tangent for another day. You're on the examination table, right? And they make you scooch to the very edge, and you're in the lithotomy position, which basically they have the stirrups in your legs up. And whole process similar to the IUD. They insert the speculum into your vagina, to your cervix, and there's a string that comes out of the IUD, so they just pull it, and it guides the IUD out of your uterus. So I hear her say, I can't find the strings. Excuse me? Not again, bro, not again! Oh my god. So she's like, I can't find the strings. On top of that, so, you know, get situated. Clearly I'm bleeding all over the place, but get situated, and on top of that, my hemoglobin, just for reference, a normal hemoglobin is about 12 to 15, depending, 11 to 15. Obviously depends male versus female, but female, as far as I can remember, is like 12, 11. 11 to 12 to 15. And mine was sitting at a calm 7.7, at least that's what I saw on the machine. They marked it as 7.8 in my paperwork. And then she made me get, some labs done, my blood work. And my blood work was even lower. It was 7.6. And that's half what it's supposed to be, okay? Typically, someone needs a transfusion at like 7. But she was trying to push the IUD, another IUD method, before like she even tried to get the first one out. And I'm like, no, like, anyways. So she said if it gets worse, go to the hospital. That was Tuesday morning. I had my appointment, which I was in the office all day. And so that was Tuesday morning. She's like, if it gets worse, go to the hospital. Wednesday morning comes. I'm like, it got worse. This isn't normal. Let me go to the hospital. So from Tuesday morning, my lab was about 7.6, about 7.8, 7.6, what have you. And I go to the hospital, and it dropped down to 7.2 in the matter of less than 24 hours. Need I remind you, 7 is where you need a blood transfusion. So, now, this hospital that I went to was so, when I'm filming this is currently May 28th. This was last week, last Tuesday. So, my boyfriend wanted to come with me, but obviously it's during C-19, and he wouldn't even be able to, like, be in the back with me, like, be in the room with me. So I was like, just go to work, it's fine. So I drove myself to the hospital, and it was the closest hospital, which was the only reason I went there, and 2, because they had an OB/GYN there. But, boy, was it a mess. It was an awful hospital. Now, I'm not going to name the hospital because, 1, y'all not about to sue me. I took my loss of damages since this video went out. Lies. Y'all not about to sue me. So, I'm not going to mention the hospital. And it's just not worth it. But, and also, like, I don't want to give out, like, close to the location where I live. Basically, this hospital has a bad reputation for lack of quality of care, as far to the extent of having patients die. Now, obviously, patients just die normally, like, that's, you can't avoid that, but it's just, like, due to their lack of good quality medical care. You see what I'm saying? So they were not going to in the hospital, but I get there. They get all my results from, like, Tuesday, which is, like, the day before, or whatever, and I'm clearly dropping. My hemoglobin is clearly dropping, right? So they do the vitals, they do the blood work, or what have you, and they're like, okay, you have to wait for the OB/GYN. I was like, okay, cool, fine. I had a transvaginal ultrasound performed where they stick a speculum up your vagina into your uterus and just look at your ovaries, your fallopian tubes, the whole shebang, right? So the IUD was no longer in my uterus. It was under the assumption that it was expelled out of my body, and I probably passed it with all of, like, the blood clots and, like, the blood and stuff, which I didn't see. Obviously that's probably what happened, but I didn't see it, but most likely, and so after I got the ultrasound and everything, that's when I think that's when I saw the OB/GYN. Now, all they wanted to do for me was give me a depot shot, which they didn't even have, mind you, on hand. And then we have to wait for, the depot shot because we don't have it in the hospital for like an hour or 2. And I said, okay, but what are you going to do for the bleeding? Like, I'm actively bleeding. 1, nothing was done to address the bleeding or tell me where the bleeding is coming from, whether it's coming from my vaginal canal, whether it's coming from my uterus, whether there's any rupture. The first OB/GYN that I saw on Tuesday told me that my cervix looks intact and everything like that. And I'm under the assumption that, it didn't rupture my uterus. But nothing was done to address those problems because I'm still actively bleeding. What is the depot shot going to do for me, right? And also my hemoglobin is steadily dropping, and that's not going to do anything for my, my red blood cells. And the first OBGYN that saw me on Tuesday just wanted to put me on iron supplementation and a heavy hormonal to stop the bleeding, but I just went to the hospital, so I didn't even pick up those medications. So the first hospital I went to just wanted to give me the depot shot. I said, okay, well, what do you want to do to address these issues? And she's like, well, we can give you an iron transfusion. Again, what is that going to do for my hemoglobin? And I needed a blood transfusion, okay? That's what I'm trying to get at. I needed a blood transfusion. And they didn't want to do anything to address the problem, the initial bleeding, because, like, even if you give me the iron transfusion, I'm still actively, heavily, and currently bleeding. This is, like, a no-brainer. Like, sorry. I'm not a medical professional, but I know enough. So, I was done talking to her. I was like, you know what? I would like to be transferred to another hospital because clearly they don't know what they're doing. In my unprofessional opinion, adequate medical care. So I said, you know what? I want to be transferred. So they send in the ER doctor and they're like, you know what? We'll transfuse you. Go over the risks and what have you. And I'm like, okay, all right. So he comes back in again. And at this point, I told my brother, who's like a paramedic, and I also have some medical background or medical information because I went to nursing school. And I got up to my senior year, like I had 1 semester left. So I did all my clinical rotations and I, got through my OBGYN portion of my nursing school. So I know some. And the doctor comes in back for like a 3rd time or whatever. He's like, we should probably do like a CT scan just to see if it's not in your abdomen region and it's not elsewhere in your body. And my brother at this point, he was fed up. He was over it. He was like, get out of there. Like, get out of there. They don't know what they're doing. I'm coming to pick you up. Luckily, but not luckily, he had hurt his arm. He had hurt his hand at work, so he was leaving work as I was telling him all of this. So, like, we're both taking turns just having issues left and right. So, he left because his hand was, like, messed up, and he, like, came an hour from his place, his job, to come pick me up from the hospital, to then take me to another hospital that was an hour away. Thank you. Thank you. So, you know what? I was like, after that, I think 30 minutes go by, and I told my brothers, and somebody comes into my room, because obviously, like, getting blood takes like an hour or two, and so somebody comes in to change the sharps, like where all the needles go and stuff like that, and it's called the sharps container. So somebody comes in to change the sharps container. I was like, you know what, can you go get the nurse? 30 minutes go by, and I'm like, you know what, and ER technician pops their head into my room. I said, you know what, I want to leave AMA, which means against medical advice. It's a piece of paper that you sign that you know that you are whatever condition you're in and you still want to leave, and you legally have to sign the paperwork to go. So I was like, yeah, I want to sign an AMA. I'm ready to go. Within minutes, they bring down the little cart machine or whatever to do the CT scan or whatever it was. And they're like, oh, yeah, we have the blood ready now. Like, are you sure you want to leave? I'm like, yeah. So the ER doctor was like, well, why do you want to leave? I said, X, Y, and Z. And then the nurse was like, oh, well, are you sure you want to leave? Because you're going to have to start this process all over again. I was like, yeah, no, I want to go. And in the middle of explaining to the doctor, in between, after speaking to the OBGYN and speaking to the ER doctor, he's like, I can tell, like, your heart is racing. And I'm like, yeah, because I'm upset. And I just start crying. And when I do this thing, and I hate crying. I freaking hate crying. But, like, when I'm, like, really upset to the point of anger, I just start crying. And honestly, like, I'm drained. I can't even articulate. Obviously, I'm able to articulate, like, to the camera now how I was feeling and what, like, needed to be done and what I felt needed to be done. And it's just, I was getting upset because it was just like, you guys aren't listening to me. Before I spoke to the surgeon, right, the first initial time, sorry, I'm like all over the place, but like the first time I like spoke to the OBGYN, and I was like, well, what are you gonna do afterwards? She's like, oh, would you leave your depot shot? I was like, okay, what about the bleeding? She's like, oh, we'll give you an iron transfusion. And I said, well, what about a blood transfusion? Because 7 is at the point where you need a blood transfusion, and I'm sitting at a 7.2. And she's like, well, I wouldn't give my own kids a blood transfusion until they're at 6. like a hemoglobin of 6. And I'm like, you're passing out at 6. And I was just like, she's like, well, you know, there's risk, you know, HIV, da, 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 da. I said, yeah, I know, that's why the blood is tested. Obviously, there's still some risk, obviously, you know. But it's just like, she's trying to convince me otherwise. I said, well, if you're not going to transfuse me at 7.2, well, why don't you run my labs again? Because clearly I'm dropping, like, by the freaking hour. And she's like, well, we're not going to run your labs again because insurance is not going to cover it. You already had lab test results yesterday, which is Tuesday, and this morning. Let me tell y'all something, okay? If you're at an ER and, you know, they admit you or whatever, they cannot refuse you. Legally, they cannot refuse you medical care because your inability to pay. I'm going to say this again for the people in the back. If you are in an ER and you get admitted, they cannot refuse you medical care because your inability to pay. Now, if I'm requesting a service as simple as a lab test result to get run again, and your response is no because your insurance won't cover it, you then have to sign a paper legally stating that you refused a service that I specifically requested, which she didn't do, obviously. And that should not have came out of her mouth. For her to fix her face and say that she's going to refuse me a service because of my insurance, it should have never came out of her mouth once. Like, anyways, if you're going to refuse your patient a service that they're requesting as simple as a finger stick, because that's literally all you have to do to check someone's hemoglobin is a finger stick. If you want a more in-depth look into the lab results, you can do a whole blood draw. But like, for her to say, oh, your insurance is not going to cover it, we're not going to do it again, but clearly my hemoglobin is dropping, and the reason why you don't want to give me a transfusion is because I'm not low enough. Make it make sense. So let's just speed up. Let's skip that part and go to me wanting to sign the AMA and speaking to the, you know, the surgeon, the nurse, everybody comes in after I say that, and the ER's doctor is like, you know, why don't you want to leave? I mean, why do you want to leave? And I say X, Y, and Z, and I said, you know, she told me, you know, she's like, well, who told you that? I said, the OBGYN told me that. Because he knows dang well that she should have never said that because legally they cannot do that. So, now, I leave, y'all. I did. I get out of there. I get it as fast as humanly possible. And now the doctor is like, well, you understand that, you know, you're at risk of, like, passing out because my hemoglobin is that low. Now that's your concern of me, like, leaving. He's like, you could potentially pass out, da, 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 da. I said, no, I want to go. I want to leave. Get me out of here. And well, I didn't say all that. I just said, no, I'm ready to go. I'll do it all over again. Yep, that's fine. Sign the paper, I'm gone. And I got, like, the paperwork and stuff like that. And I, like, wrote down their names. Because, like, legally, like, I should report them. I really should. But, like, you know how it is when you're doing a survey, you just don't. But, y'all, the trouble. I don't want to go through the trouble and, like, typing it up and, like, I should, though. But anyways, so at this point, I signed myself out. I'm still in the hospital waiting for my brother to come pick me up. The whole ordeal took enough time for my brother to get there. So, like, by the time I get to the main hospital, to the main lobby of the hospital, my brother's, like, gonna be there in, like, 5-10 minutes, right? So, picks me up, takes me to another hospital. From 7 a.m. to 2 p.m., I was at the first hospital. And then we had to drive an hour to another hospital. And we get there around, like, 3:30ish. So now I have to start the whole process again. So my hemoglobin at the first hospital at 7 a.m. was 7.2. By the time I got to the other hospital around 3:30 p.m., it dropped again to 7.0. You can see now my hemoglobin at Tuesday was like 7.6, 7.8. 24 hours go by, I'm at 7. Again, shall I reiterate, 7 is where you need a blood transfusion. So guess what I got? A blood transfusion. You know, and it's not like something, a procedure that I want to go to. I'm not that type of people that likes to be sick, that likes to be in and out of hospitals. I'm too busy for that, okay? I work 6 days a week. I don't have time to be sick. I just don't. My rent is coming up. Like, so, anyways, so I get to the other hospital. I have to do the whole process again. Lab tests, transvaginal, ultrasound, everything. Again, IUD is not in my uterus. And I start, you know, and when you're in the hospital, you get this experience where you have to tell your story, why you're there, everything that's been going on, to like 10, 15 different people at the same time, over and over and over again. Can you just read my rap sheet, please? I don't want to tell this, like, again, I understand you have to, just in case your story changes from person to person, or, you know, just in case someone misconstrued it or miswrote it, whatever the case may be. You're seeing this person, obviously this is the 15th person you saw, but this is the first time they're seeing you, so they want your personal account as to why you're there and what's been going on. So I understand, but it's a hassle, okay? It's just a headache. And it's just like, same thing with like saying your name and date of birth over and over and over again. You know, you're just over it. Nurse comes in, and then a nurse practitioner comes in, and then she got a little attitude, like I did something to her. And she's like, well, why didn't you go to the hospital Tuesday? I'm like, it wasn't this bad Tuesday. Like, it got worse, so that's why I went Wednesday. And she's like, well, why did you leave the first hospital? I said, well, I didn't feel like they were adequately providing medical care. And mind you, my brain is fuzzy, okay? My hemoglobin is like half what it's supposed to be. I can't articulate my words the way I want to, and it's just frustrating. So, and then I'm in the middle of telling her, and she keeps interrupting me and interrupting me. I'm like, you know what? If you let me finish, I can tell you. I was over it. She's like, okay. I'm like, well, stop fucking interrupting me. I'm sorry. Excuse my language. But I was like, freaking over it. Think I want to be here? I don't. So she's like, well, we're going to need to transfuse you, without me even saying anything, without me suggesting what needs to be done or what I want to be done. She's like, you know what? Yeah, we're going to transfuse you, because they were still deciding about like the bleeding and stuff. So okay, first thing we're going to need to do is like transfuse you. They're going to consult with another doctor to come up with a plan as to for how they're going to treat the bleeding, right? So they're like contemplating different medications to stop the bleeding, and she's like, worst comes to worst, you know, there's a surgery or what have you, but, you know, they don't think we'll get that far, you know, just trying to, after the transfusion, focus on the medication that they can give me to stop the bleeding. So I get the blood transfusion in my hand. Now, for those of you who've never gotten a transfusion, thank God, count your blessings. It is painful. Like, the most painful spot you could possibly get a transfusion, blood transfusion, is in your hand, because your veins in your hand are much smaller in comparison to, this is called the antecubital space, in your inner elbow, right? The opposite side of your elbow. But my veins were shot, okay? My blood is like, I'm at low blood supply here, okay? So my veins in my elbows were freaking shot. So they had to do, the second thing for blood transfusion, they need 2 open IV ports. So they started with one in here, like on my forearm, because again, my veins were shot. And then they put the other one in my hand. With the transfusion, right, you can't bend your arm all the time, right? And it's just like, even just me slightly moving my hand just to fix it if I had a cramp or whatever would have stopped the transfusion, and the nurse would have to come back, restart it, whatever. It would cause a kink in the, you know, the IV or whatever. So that's why they went into my hand. But the thing with this is your veins are smaller, and it was just painful. It was like not even like, I can't describe it. You could kind of feel the blood going into through your hand or whatever, but it was just like, it wasn't like a burning sensation, it was just like sharp pain. And like the longer I was doing transfusion, the like increasingly more painful it got. I got a unit of blood, and I think it took about like 2 hours to transfuse it. So like the pain was there the whole time, but you know what, it is what it is. It had to be done. After that, another doctor comes in, And he talked about like the other methods, and he's like, so we're gonna do a D&C. And so the person who came to see me ended up being the surgeon. So a D&C is like a minor surgery, and it's called a dilation and curation. It's typically used for like abortions and stuff like that, but in this case it was used to stop the bleeding because it was intense. And it's where they put you under anesthetic, right? It's a minor surgery, so they put you under, and they again insert a speculum and scrape the top of my uterus, and they take a huge chunk of that tissue and send it off to the lab and get it tested. So right after the blood transfusion is when I get like, they sent me in to go for surgery, and they didn't wait until my blood transfusion was done to do that. It was just like as soon as the OR team, which is the operating room team, was ready, that's when they set me off. But luckily, like right when my transfusion was done was when the OR team was ready to send me into surgery. So that just worked out. So I didn't have to be carried with like a pint of unit of blood with me to the surgery room. So after all that was said and done, I got like discharged at like 2:30 in the morning, and I was calling my brother, but like he fell asleep, and he felt really bad about it, but it's like, it's fine, he fell asleep. So I called my best friend Kiana. Shout out to you. Thank you, bitch. Like you're my day one. I'm cringy, sorry, but thank you so much for doing that. I have like just an amazing support system behind me, like family and friends. Like thank you just in general. But yeah, so she picked me up. I think the hospital was from like 30 minutes from her, but like she had to like drop, because I was obviously sedated, and they said, you know, you can't make any big decisions 24 hours, you can't drive, you can't do anything, you can't even take a cab. Someone has to come pick me up and take me home. Obviously it's dangerous, like if you're getting a random cab with a stranger and you're like half sedated, like anything can happen. So that's why it has to be somebody you know. And as far as D&C wise, he basically just said nothing inserted into the vagina for like 2 weeks and watch for the bleeding, because that could be a result. But honestly, the bleeding completely like stopped after the surgery. Every one of these doctors and GYNs that I saw were pushing me getting another IUD. Even though I was going through this, they were still pushing the IUD. I don't know what these doctors are getting incentivized for, which means getting paid for, because sometimes doctors get incentivized, which means they're getting paid to push a certain product, as far as like medication wise or brand wise. And y'all, call me conspiracy theorists, but y'all getting paid. Somebody's getting paid, okay, to push this goddamn product. And stop, like I don't want it. And she said, you know, it could be a great benefit. I know you had an issue with this one, but that's because it was non-hormonal. This one's hormonal. You should have a much better chance with this. I should just cut her off right then and there, but that would have been rude, so I didn't say anything, because nothing any of these doctors would have said would make me insert another IUD into my body. The first one put me in a hospital, sis. Why would you think I want another one? My only other option was to be put on a hormonal oral contraceptive, which is the pill, which is what I started taking today. And I'm gonna just have to bite the bullet. Like, and the doctor was like, well, how, you know, well, what if you don't take it? What if you miss a pill? And it's just like, I'm gonna try not to. I'm gonna try to be diligent and just have my alarm, have my notifications. They're both set, and just carry my birth control everywhere I go. Like, I don't have any other option. Like, I can't turn the patch. The uva ring and the diaphragm are just not realistic. It's just not realistic, and I don't want to insert anything else into my body besides a tampon, okay? Because that can't get lost that much. I've never lost a tampon. So it's just, I don't want nothing else in my body. First thing was the Nexaplan, and then it bent in my arm, and tissue started growing around it, and it took 3 doctors to take it out. And then the IUD, like, ended me in the hospital, okay? I need a blood transfusion and a surgery to help me. Like, I'm not going through that again. Or even if it's a different, I'm just not doing that, okay? No. Stop asking me. Thank you so much for watching. Like, comment, subscribe, because YouTube makes me say this. And if you watch this video all the way through, comment down a little red drop emoji. I'm going to assume that means blood. Bye.